Hi, I'm Heather Whitmer, one of the owners here at LeBeau Skincare Center, and I'm here with Hillary Leibowitz Schaefer, who is the other owner at LeBeau. And today we are going to talk about microneedling. So thanks for being with us here. Hillary, what is microneedling and what is it used for?
Sure. So microneedling is a process where we use a tool that's almost like like an electric pen in a way, and we put on the tip of it a cartridge that has needles. So anywhere from 36 needles or 12 needles is put into the end of that. Those needles are pulsating in and out, and what we want to happen is to create little micro injuries into the skin to go down to the dermis to cause some restructuring. Whether we're dealing with a scar or stretch mark, with that we're going to use more of that 12 needle cartridge, or if we're dealing with uneven skin tone, fine lines, texture of the skin, then we're going to use more of that 36 needle cartridge.
So when you talk about needles, is this painful?
We always use numbing beforehand.
Okay.
So I like to numb the patients about 30 to 45 minutes prior to the procedure. It is uncomfortable without the numbing. With the numbing, you really don't feel much of anything other than maybe a little bit on the forehead. That's what patients usually say is the forehead's the most uncomfortable area. Definitely tolerable though, especially with the numbing.
And what would you use microneedling for? What is the best concern or issue to treat with microneedling?
So anything from acne scarring to stretch marks to an area that has like a scar that would be there, to fine lines, to deeper lines, to sun damage, especially complementing with a specific product or specific product regimen.
Okay. And does it help with pores or things like that? Like, is it?
It will help to tighten the pores. The biggest change is more of just the texture of the skin. It kind of helps overall. So from pores to the fine lines to kind of a little bit of loss of elasticity, it helps to tighten that.
Okay. So who's a good candidate for the procedure?
Really, anybody can be a candidate. I don't like to do patients that have really loose skin.
Okay.
I would say it's easier to answer who's not a candidate.
Okay.
So real loose skin or acne. I tend to stay away from acne with it. But other than that, anybody could have microneedling.
Okay. And what is the downtime with the procedure afterwards?
So depending on how aggressive we go with the treatment, you could have somebody that walks out lightly pink to somebody that definitely has more redness and kind of like a prickly dotting from where we made those little micro injuries. If you had somebody that you treated a little more aggressive, they might be red through the next day.
Okay.
If you have somebody that you went a little lighter with, they might be red only or pink that day.
Okay. And when you talked about the difference between the amount of needles, what determines how many needles you use? Or
so you can get a little more aggressive with a 12 needle than you can with a 36,
which
is kind of weird.
Yeah.
And how I kind of talk about that to explain that is, if you were going to lay on a bed of nails, it is way more comfortable to lay on a bed of nails that has a lot of the even nails all laid out than it would be to lay on a few nails.
Okay.
So that's why when you're dealing with 12 needles versus 36, the 12, we can get in there and cause more of the micro injuries into the tissue, which we need to do that. So down into that dermis is where that's like our blood level. So when you cut yourself and you bleed, you've cut down to the dermis. We need to go into there in order to let our skin know that something has happened in that dermal level and it now needs to be restructured. That's the only way that you can get improvement in a scar or a deeper line or even a fine line, is going down into that dermis.
So, and a scar would include also acne scarring?
Yeah.
If you had...
Yep, a divot or discoloration, absolutely.
Okay. And how many treatments do you typically recommend?
Typically, we recommend 6.
Okay.
You really need that many in order to cause that much of a change. Again, we're causing micro injuries, so we're not taking all of the tissue off.
Sure.
We're creating a pattern of damage down to the dermis, so our dermis is reading there's something that happened, it needs to repair, and as it repairs, over time, we're getting more collagen to come up and our skin tissue is looking better. So every time we have a treatment, we get better and better. So it does take 6 to get to your full result.
Okay. And how far apart do you recommend those treatments to
About
be?
once a month.
About once a month.
Yeah.
And then after you go through your series of 6, is there some type of maintenance that you have to do, or what do you recommend in order to maintain the results that you've achieved?
So you're going to age from the point that you end on. So you really want to, no matter what service you do, you want to keep up with it over time so that it keeps those results going. So, you know, you might want to do 2 or 3 a year just to kind of keep that collagen, keep it filling in.
Okay.
And keeping it looking nice, because it is something where if you do nothing and you age from that point on, eventually it's going to age you back to where you were.
Right.
That's why, like, acne scarring, especially when you're 18, you notice it. But then if you cause improvement, it's better. But then as you age, you notice that kind of looking, you can see it again.
Right.
It's because of the breakdown into that dermis. So creating this back again, we're bringing you back youthful and bringing back all those years and making the skin look smoother, but you're aging still. So you've got to keep up with it.
So just like anything else, it's maintenance. Can't go to the gym one time
No.
and expect to have a great body.
Exactly.
Gotcha. Anything else that you can think of with microneedling that is important for patients to know about?
I don't think so. I think it's nice that there is an alternative that doesn't really have the downtime, that can address the fine lines or the scarring, stretch marks,
Yeah.
you know, areas that are just a problem for so many people.
Sure.
And to not really yet necessarily need to have the downtime is a great thing.
Yes. Okay. And once again, we do offer free consultations with all of our services. So if you're interested in microneedling, please give us a call.